My name is Goodman, and I am a physician. I'm a cardiologist. I've been around the giants of cardiology and learned very classical approaches to treating cardiovascular disease specifically. I was intervening once the house was burning. And when it's all said and done, sometimes there's nothing left of the house. And I started to realize that I wanted to try to make a difference before people end up having the house burning. Being healthy is not just because you've got a good blood pressure or because your cholesterol's okay. It's mind, body, and spirit. And all those three things go into being healthy. You know, I work in a hospital where patients come in and they have chest pain, and as I've told you many times, it's not cardiac chest pain. And then I start talking to them and I find out they've got all sorts of social problems. When you are stressed, when you have got high adrenaline levels in your system all the time, the immune system starts to get depressed. So this interaction between stress and your ability to fight infection and ward off cancer and avoid heart disease is very, very important. As you can give people pills, you can say your blood pressure is high, we're going to bring it down. But what you want to get at is, why is it high? I had a patient of mine, divorced, no family. He was in his 60s. And we got very, very close. And he suddenly developed a blockage in his artery. And I went just before the surgery to say, to say hello to him and tell him that he's going to be fine. And he was devastated. And I said, what's wrong? And he said, the surgeon just came by and told him about what could happen. I said to him, just remember, I'll see you after surgery and I love you. And that was that. And 2 weeks later, when he came to my office, he said, I want you to know something. What you said to me when you left the room was the reason that I wanted to live. Because he said, I thought to myself, these were his words, he said, if there's one person left in the world that still loves me, I want to be around. I happen to be Jewish, and for me, going to synagogue every Shabbat is a place for me to go where I actually nurture and feed that spirituality in me. I'm not religious in the sense that I'm really observant with all the rules, as you know, all the laws, and every religion's got laws, but I go because for me, just taking off and splitting the week, I love the idea of Shabbat, where you just say, stop. We have to take a day to nourish yourself. If we can, one by one, get people within themselves, firstly, to take on their own health as something that they're responsible for, and then their relationships, and then spread it out into the community. When the community is healthy, you have people that come together to help other people. It's unbelievable. What I see as holistic medicine is being able to look at the whole picture in that person's life and try to make it rosy for them.